What is nasal bleeding? Also called as epistaxis. The bleeding from the nose is called as epistaxis. It usually occurs because of hypertension or due to nasal picking, where the patient has got a habit of picking out from the nose. Either they remove the crust or the hair from their nose. That time there will be a damage to the nasal septum. The nasal septum is a common wall which is present between the two nasal cavities. This nasal septum has got a rich amount of blood supply. 5 arteries on the right side and 5 on the left side come and unite in one area, which is antero-inferior part of the nasal septum. That area is called as Little's area. The 5 arteries which come over there are the anterior ethmoidal artery, posterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and the septal branch of superior labial artery, which is a branch of facial artery. So I repeat: anterior ethmoidal, posterior ethmoidal, sphenopalatine, greater palatine, and the septal branch of superior labial artery, which is in turn a branch of facial artery. So these 5 arteries on one side and the other 5 arteries on the other side will come on the anterior inferior area of nasal septum. So there is one area called as Little's area. So whenever there is a high blood pressure, the heart will force the blood in a more forceful manner, so that blood will come and gush through these blood vessels and pour down. Nasal pour down of blood will occur. That is called as epistaxis. Specifically speaking, anterior epistaxis. Rarely some patients bleed by the posterior aspect of the nose into the nasopharynx. They start spitting the blood. That is posterior epistaxis. But both these epistaxis, either due to nasal picking or hypertension, is controllable. That is, whenever you feel a patient has got a nasal bleeding, what we have to do? So this is the most common question. Most patients just squeeze their nose like this and keeps removing the blood. All that you have to understand is bleeding time is 5 to 7 minutes. That is, platelet will come and form a temporary clot for 5 to 7 minutes. All that the patient has to do, or the person who is suffering from nasal bleeding has to do, is apply pressure on both the nostrils continuously for 5 minutes. During that time they have to breathe by the nose. By this time we can go to the nearest hospital. They will do nasal packing in the nose with cotton gauze. Then if it is due to hypertension, they will give you anti-hypertensive medication, IV. So they will admit you and monitor you, see the reason for the epistaxis and treat accordingly. So all that you have to do is apply pressure continuously for 5 minutes. Thank you.